Expect to start seeing a lot of teal around the Triad. We're a few days out from September. That kicks off Ovarian Cancer Awareness Month. We want to make sure you know the signs and the symptoms, and that's why we have Dr. Kelly Leggett from Cone Health here today. She's the Chief Clinical Transformation Officer and OBGYN. She can discuss warning signs, treatment plans, really everything you need to know. So Dr. Leggett, we're going to go ahead and jump in. First off, for people who may not know, how prevalent is ovarian cancer?
Ovarian cancer is the fifth leading cause of cancer among women, cancer deaths among women, and is the most common GYN cancer among women. It will affect about 20,000 women this year will be diagnosed with ovarian cancer, and 13,000 women will approximately die of ovarian cancer this year in the United States. So it really is more common than most people know, and that's why we're getting out the awareness and painting the town teal.
So, you know, some people say the symptoms can be subtle. Is that true? And what symptoms should women look out for?
Ovarian cancer can masquerade as urinary symptoms and gastrointestinal symptoms. So many women just kind of blow these complaints off. The most common symptoms are abdominal pain, pelvic pain, bloating, and feeling full early. Other more rare symptoms are menstrual disturbances, urinary frequency, pain with intercourse, but all of these things you can ask your doctor about to determine if you need a test for ovarian cancer.
So when it comes to testing, is there a certain time frame of experiencing any of these symptoms that would indicate, you know, it's time to go ahead and contact a doctor?
Yeah, so if something is new to you, so periodically through a woman's life, you can have these symptoms. So if something comes up new, that's when you call your doctor. And if these symptoms have lasted for a month and about 12, you notice it about 12 times in that month, I would definitely contact your doctor.
And who should they contact? Who should they contact?
So hopefully most people have a primary care doctor, and that can be a great place to start. And even more importantly, I hope that most women do have a gynecologist, and we are always here to help them. So if that is not available, then maybe even a gastroenterologist.
So once they contact the doctor and they make the appointment, what can they expect at this appointment? Are there specific test screenings for ovarian cancer?
So there are no screening tests for ovarian cancer that we do across the population, but once you develop symptoms, the most common test ordered is an ultrasound of the pelvis. And this would be both an abdominal ultrasound and a transvaginal ultrasound. It is done in all of our Cone Health office buildings and also in other doctors' offices around the Greensboro.
Do people need regular checkups like for other illnesses?
Well, so during your yearly exam with your doctor, they would ask questions about pelvic pain, abdominal pain, feeling full. And so that is your time to think about what you're feeling and report anything new.
Okay, great information. Thank you so much, Dr. Leggett. We're going to come back and we're going to talk more about risk factors and family history. We're also going to look at ways you might be able to reduce those risks. That's coming up after the break, so stick with us. Welcome back. We are back with Dr. Kelly Leggett. She is a OBGYN with Cone Health, and today we're discussing ovarian cancer and the risk you need to know about. So Dr. Leggett, this is a big question a lot of our viewers probably have. Are there risk factors that increase a woman's risk for ovarian cancer that women need to be aware of?
Yeah, most importantly is knowing your family history. If maternal relatives have a history of ovarian cancer, breast cancer, colorectal cancer, and even men can have breast cancer. So knowing your complete family history is important. There are some other risk factors for ovarian cancer besides your genetics. History of pelvic radiation. There's a mild association with endometriosis. And also if there's been exposure to asbestos, which is pretty rare these days. Women who have never been pregnant and carried a child to term, they're called nulliparous. And if you are nulliparous or never have been pregnant, you also have an increased risk of ovarian cancer.
So talk a little bit more about the possible impact from having a family history of ovarian, breast, or colorectal cancer. You can't change that history, so what should you do if you fall into that category? How concerning is that?
So we have genetic tests that are available that insurance usually covers for, and there's also charity care programs through some of the genetic testing. So if you don't have insurance, they are still available. And they can take your family history and draw blood and see if you carry one of the genes that can increase your risk of ovarian, breast, or colorectal cancer. And even if that is negative, if you still have a lifetime risk of having one of those cancers, we can increase screening for those types of cancers. So just knowing your status is really important to be able to get the right screening tests.
And are there steps women can take that might help reduce the risk for ovarian cancer?
There are a few ways you can decrease your risk of ovarian cancer. Oral contraceptives can decrease your risk of ovarian cancer. Also breastfeeding, prolonged breastfeeding will decrease your risk of ovarian cancer. Having lots of children does the same thing. Anything that keeps you from ovulating decreases your risk of breast cancer. I'm sorry, ovarian cancer. Sorry.
So as we know, a lot of women put off their needs, their health needs. They're busy taking care of other people, their family, their children, and they feel like they don't have the time or think whatever it is will go away. So it's not that big of a deal. What are your thoughts about that when it comes to women like slowing down and, taking their health into consideration?
Absolutely. I think the airlines have it right. So let's say when the oxygen mask comes down and you have a loved one with you, you must take care of you first. So then you are available to take care of your loved ones. And that goes for your health as well. So make sure you go to your routine screening appointments, do all the tests, express your concerns, and then that way you'll be healthy to take care of your loved ones. It only takes an hour a year to get these routine checkups that can identify some of the symptoms and lead to testing and life-saving diagnoses.
Got to make the time. You got to make the time. So how can someone get help from Cone Health specifically?
Well, we have lots of primary care physicians. We have many offices, OBGYN, the Center for Women's Health Care, and we are all taking new patients. Please call and make an appointment, and we'd be glad to see you.
Okay, so a final message about ovarian cancer that you want our viewers to be able to take home with them.
Yeah, so know your family history. Knowledge is power. Listen to your body and make sure you go to your yearly screening exams with your doctor and advocate for your health.
All right, anything else you'd like to add?
No, thank you. And look for those businesses that are painting the town teal and get the word out.
All right. Thank you so much, Dr. Leggett. And we don't want you to miss any of the information here. So in just a few minutes, we'll have everything we just went over on our website. Just head over to Your Wellbeing section on WFMY News2.com.